That's very high in touristic counties because of the smuggling that was happening there. On the other hand, there is also an expansion on recreational sales, mainly due to tourism, to interstate smugglers that have moved from the medical market to the recreational one, and to those occasional users that before the legalization were obtaining the product through the black market or illegal in general. Another repercussion is that we see price discrimination is successfully achieved and is economically and ethically favorable, as we said. And this dual licensing scheme appears to be optimal in so many dimensions and should be considered maybe as a proof of concept in general for any legalization. There is just one last thing I want to talk about, and is the paradox that we see in Colorado. So if you assume that the regular users tend to be more in the medical market because of economic advantage, and we assume that occasional users tend to be more in the recreational market because they care less of the price and they just want to buy, and they don't want to go through a physician recommendation. But we see that the regular users actually consume 7 times more of the product, but the medical market is actually lower than the recreational one. So how is that kind of explainable? We should have the medical market greater and the recreational lower if the regular users are buying there. And the gap is actually increasing. So the recreational market is greater and expanding because of tourist interstate smuggler maybe, or maybe because there is a different way they actually produce their products. So patients in this case prefer to grow part of their demand. As you can see in Colorado, there is an increase of the patient now, almost 90% right now declare to self-grow part of the product among the patients. So it means that there is like a different way they obtain the product. They don't all buy in the medical centers, but maybe most of their consumption is actually through their own growing facilities. On the other hand, we see a normalization of cannabis use in Colorado. That might be actually that the participation rate, as Jonathan was advising, is increasing and more people are actually using it. We hope it's not regular, they're not kind of problematic user, but they're increasing and they are substituted maybe other substances like alcohol or opiates. There are other research that will show afterwards. And in this scenario, there is an interesting, like a last point about how full legalization with dual pricing might be an optimal kind of framework, taxation framework, not only for those touristic areas or those areas that have a lot of prohibitionist countries around them, but for every sort of jurisdiction where the cannabis is used is normalized. And because of the fact that we keep a high price for occasional users and we reduce the risk of abuse, and a low price for patients that can obtain the therapeutical product for a cheaper price. And a last point that I want to say is also that, thank you for listening, and that the fact that the market, the recreational market is actually bigger than the medical one, might say that actually the industry might not depend only on those kind of those using it in a self-harming way, but maybe it might be used by just recreational users. Thank you.
There was a model presentation, not only in terms of analysis, but also in timekeeping. I think there is just a minute or two if there are any quick questions, especially of a clarifying nature on this talk. Most of the questions will be at the end and integrate. Does anybody have any quick clarifying questions?
One, are the dispensaries losing money if people are growing their own, and how much loss is there?
I didn't estimate that, but I don't think it's a problem if people grow their own product. I think actually is less. I mean, it makes the industry give less incentive to the industry to kind of incentivize people that have problematic use, because if they know that they would consume it themselves from their growing, maybe they would just make a marketing or a sort of, they would try to get more recreational users in a way, because the regular one would just grow their own product. So it gives less of an incentives for these industries to incentivize a bad use, let's say. Sorry.
Over here.
Yeah, I was just wondering, I think there's a lack of participation by the doctors, by the medical community.
Absolutely.
So I guess, maybe patients are just like, the hell with it, it's too frustrating, let me just go to the recreational market. Do you have any statistics on that?
Well, I know that there has been, over 2013, about 10 doctors have been giving kind of prescription for half of the patients in 2013, and these doctors have been kind of, they found out that they've been, the department made something against them, but in general what I think is that the fact that doctors see these patients only once to get the recommendation is not optimal, and it should be like more periodic, maybe annual visit to the doctor, to see them more often and maybe give different kind of prescription. Yeah.
Could the gap in the market between the recreational and medical market also be because medical consumers are using less amounts versus recreational users because they're managing to their symptoms?
No, I think I mean, so the medical users use less than recreational one. I will not talk about how they use the product because I mean it's just about how they call it. I would just think that the regular users that are mostly in the medical market, they would always use more than the recreational one. Because to be in the medical market, it means that you care about the price and it means that you consume a lot. So regular users would always consume more than occasional ones, and those that are in the recreational market, I think. So yeah, I don't know. I don't have data to say. Yeah.
Thank you. Let's thank the speaker again. We'll hold other questions until the end and talk on all of them. So in addition to
I'm presenting it on behalf of Patrick Murphy and John Carneval. It was put out under the Public Policy Institute of California. So I have limited parameters within which I can speak for Pat and John. That said, I think I can field questions. I'm going to jump right in and get, how does this work? Hang on. There we go. I'm going to give you sort of the thesis up front, and then we can see what we have time for. For starters, the paper is not considering whether California should legalize recreational marijuana. It's essentially saying, given that happens, how do we rectify the primary goals of sort of reducing the illegal market, sort of sheltering public health and safety, and also maximizing revenue for the state. And obviously those are not necessarily all going to intertwine perfectly. Basically, Pat and John are saying that California should begin with a tight regulatory system that tries to create a single market for recreational and medicinal marijuana and then loosen as needed. And this is sort of driven by the process, and this is sort of quite different. I don't know if it's from all of them, but certainly from the presentation that came before. Essentially what Pat and John did was they did a series of extensive interviews with the regulators in Colorado and Washington, designed to sort of make this report as pragmatic as possible, and essentially figure out what works and what didn't. And the conclusion was sort of logistically simple is preferable to theoretically pretty. One of the Colorado regulators basically said, and I'm paraphrasing a paraphrase because I didn't do the interviews myself, but essentially that, look, you're going to have a pretty small regulatory body sitting somewhere in the state government. It's not going to be a lot of people, and they're going to be regulating what's probably a pretty sizable industry, especially in a state like California. The more complicated you make your regulations and your regulatory system, the harder job you're setting that very small number of state employees. So in order to actually do that, their first recommendation is to sort of build into your legislation and your regulations the ability to change. This is sort of evidenced by a number of changes that happened in Washington and Colorado, right? They both crazy conclusion, but it's actually super important. That said, the report takes roughly this perspective, and this is what I'm going to try to use the rest of my time for, though I now no longer have any idea how long I'm talking. They give some background history on the actual laws. It sets up a regulatory framework outlining what John and Patrick take to be the goals. Most of them are uncontroversial, some of them perhaps will be, and outlines these particular areas: cultivation, production, processing, sales and consumption, tax and finance, public health and safety, governance and oversight. We don't have anywhere near the kind of time to sort of outline a full regulatory framework that they're recommending in 15 minutes, but it's worth sort of just revisiting kind of why we're starting at this point, and it sort of dovetails off of what John and also Mark said, right, that 24 states in DC already have medical. Recreational is now for 5.6% of the population, and California is, if you ranked it as a nation, in the top 10 economies in the world. I want to say 8, but don't quote me on that. We like to talk about how this is sort of a state-level experiment, and we all know that it's still illegal under federal law, but if California goes, and if the 12 or the 11 other states go, the experiment has escaped the lab, right? At that point, if all of those states legalize, I want to say it's 37. I had notes digitally, but now I can't see them, so these numbers may be slightly off. No, I'm pretty sure it would be 37% of people, if all 12 of those states legalized, would live in a state with recreational marijuana, and 58% would live in a jurisdiction with recreational or legal, so, or medicinal. So the question of sort of should we and will we, while they're sort of philosophically and politically interesting, are really no longer the relevant questions, which is why sort of John and Patrick wanted this paper to be so kind of pragmatically focused. I'm going to pretty much skip this, except to say that obviously, again, it is still legal under federal law, which if you're setting up a regulatory system is relevant. Right now, I don't really have a sense of how much this is already known, but right now the DOJ Cole memo is pretty much governing the federal position on this, is that if you're going to legalize, you have to sort of satisfy the provisions in this, which are, for those of you who don't know, pretty much what you would think they would be. You have to minimize criminal involvement, you have to reduce spillage to states that don't have legal markets, et cetera, et cetera. But I'm gonna pretty much skip that and sort of jump into sort of what the regulatory framework looks like. These are their goals. I think they're mostly uncontroversial. I should stop at this point and say that the paper does sort of discuss briefly what we were talking about in the big room, which is that there's actually like a really big theoretical spectrum of possible regulatory schemes, but the paper operates within the for-profit alcohol consumption model. I don't know that I would say that that's necessarily Patrick and John saying we ought to do that in a purely philosophical way. I think it's them saying this is for sure what's going to happen in California, let's figure out how to optimize for that. So that being said, this is the top level recommendations. I'm actually, how am I doing on time?
I think you're 8 or 9 minutes in.
Oh, awesome. Okay, so these are mostly, they're not things that sort of people who want a regulated market generally would disagree with for the most part, right? So they're going to be things like limiting the number of licenses and having a canopy cap with limiting the size of cultivation. Seed to sales tracking, they're fairly basic. Some of them are kind of functions of the fact that John and Patrick are assuming this alcohol model, right? So you see there that they favor prohibiting home grows, in addition to being unpopular with cannabis users. That's not so much that they're saying we don't like the grow your own, distribute for free system that kind of exists in DC, though that wasn't what the DC voters intended. I'm from DC, so it's a separate issue. It's saying that within the for-profit alcohol distribution model, the home grows cause problems, because then you're introducing unregulated marijuana into what should be a fully tracked system. And when you find someone with unregulated marijuana, you have no way of knowing where it came from. Is it legal? It's also obviously a point for spillage into an illegal market. I also should have said at the outset that obviously a tightly regulated market like this, which is what they're proposing, will be accompanied by an illegal market. And Patrick and John know that. They've essentially said that we're favoring this because it's logistically simple, it's practical, and that's a consequence that we're willing to live with. I'm going to try to talk about some of these every time, but I think this is cool. Sort of to have sort of data collection in each of these areas, and that they're all sort of important. Actually being able to track seed to sale, and then obviously tracking your use and consumption. I mean, you're not going to know how people respond to prices yet. We can learn a lot, and the whole purpose of this paper is to learn a lot from what Washington and thank you, Colorado have done. But we don't have the data yet. There are too many differences between the markets and the states. We're going to need that data too. Tax and finance, sort of learning how they're going to respond. We don't know what the price points are that are going to cause behavior to change. Health and safety, obviously you're going to need to track treatment emissions. You're going to need to actually talk about that for a second. One of the things that's interesting is about half of the referrals to treatment for where the primary substance of use is marijuana currently come from the criminal justice system. Under a legalization regime, those people wouldn't be touching the criminal justice system, probably, because they're not de facto committing a crime by smoking marijuana. Assuming that there are going to be an absolute number more and maybe a percentage number more of those people, we're going to need another way to get these people access to the criminal justice system. Screening, brief intervention, referral to treatment, expert seems like a positive one, but we're going to be losing a really big treatment referral source when we sort of take adults out of the criminal justice system. Youth, interestingly, obviously, will still be a criminal justice matter.
Thank God. Cases, so fines, violations, increased by 20% on that, and created $200,000 in fines, whereas the previous year, before decrim, it was about $74,000. There had been an ongoing tradition, even before decriminalization, of not incarcerating too many people for marijuana-only offenses. In 2014, so the first year of decrim, there were 5 people in jail, or jailed for decriminalization, or for possession of other drug charges for marijuana. The year before, there were 8. So Vermont's small, but that's still proportionally very small. And at any one time, there's about 3 people in jail for marijuana alone. And so the net cost we found of estimating, our estimate for this, the cost of enforcement of the decriminalized regime is on the order of about $1 million, $800,000 to 1.1 million. And about 2/3 of that is borne by adults, so people over 21 years old. So 1/3 to adolescents. So there are lots of, and there's actually an entire separate panel later, I think maybe tomorrow, on the range, the continuum of possible legalization regimes. In our research, we outlined that continuum ranging from a stricter rule than is already in place in Vermont, where you increase sanctions and remain prohibition and keep prohibition in place, all the way up to repeal and just see what happens and don't regulate any types of substances. Among those, the most common, there's not a pointer on here, is there? Well, there's 2 screens, so it wouldn't be useful. It would be half useful. Prohibition, so there's the idea of prohibition but decreasing sanctions, so sort of prohibiting production, something like you see, or commercial sale, but allowing for home growth is another option. And then the standard commercial model that has been implemented in Oregon and Washington, Colorado, Senate Bill 95, that was sort of interesting that it deviates from the for-profit model and called for nonprofits and for benefit, so socially conscious organizations to run the market. And there would be a limited number of licenses granted, and that's how the market would run. That bill didn't leave the floor. It was announced and went into the Judiciary Committee and then didn't move. Senate Bill 241 was a commercial model that also allowed for home growing up to 2 plants. And that actually passed the Senate with some amendments. It passed the Senate in late February and went to the House, it's by Campbell, and it sat in the House for a while, and then last week, on Tuesday, the Judiciary Committee stripped everything out, passed 241, but stripped all the provisions out of it and said, let's just set up a commission. And then on Friday, the Ways and Means Committee said, well, I think maybe it makes sense to do what the commission, or committee, they said, set up something like Washington, D.C. So again, that is, you can possess and you cannot sell. So potentially you have very expensive delivery charges for free goods and very expensive baggies for free transfer of goods. Or some, who knows, people are enterprising. But so there are 3 very different policies called Bill 241 being discussed in Congress in Vermont right now. And first they have to be reconciled within the House, and then the House and the Senate have to reconcile. So it's interesting to see what they can get done, because the session ends May 12th. So they've got to hustle if they're going to push anything into law. The other thing that's interesting about this is that this is all action that was spurred by the legislature, whereas every other legalization effort so far has been a ballot initiative. So it's a little different in formation. So we'll see what happens. And then potential productivity losses because of use. But my focus here is just going to be on tax revenue. So we set up this microsimulation model. I'm not going to go through all the details of the parameters that we set. The gist is that we assume that prices will decrease in both the illicit and the legal market with legalization of any type, though it will vary by the particulars. That there will still be a premium for legal, on average, legal marijuana over illicit marijuana. Areas like in Seattle. There's also the residual black market that you'd like to crack down on as much as you can. And then bootlegging, or a version of tax evasion. Then there's also regulatory costs. And because Vermont was pretty laissez-faire with the decriminalized regime, they weren't spending a whole lot, on the order of $1 million, as I said. The cost of enforcing a legal regime might be higher than the cost of the illegal. Of course, they're potentially offset by tax revenue, but they can look to other states as a guide for how much it costs to regulate a legal market. For instance, in Washington, they spent about $9 million between 2012 and 2015. And so that includes really potentially important things and really useful things for researchers, like a traceability system, and things that might have a big effect on the rates and types of use, like regulating advertising and the types of advertising, the size and location. This was discussed earlier in the plenary thing. So there are a few key points. Regulation, as I said, could be more expensive than prohibition. For any large-scale legalization option, the regulatory costs and ongoing costs from year to year are probably on the order of about single-digit millions of dollars in Vermont. And then there are non-trivial startup costs, because you need to figure out what you're going to do and make sure everybody's on board. And a lot of that cost is in staff time and training and deciding on what the traceability system you have is. Okay. So when we think about revenues, we can think about it in orders of magnitude. So current prohibition cost, as I said, is about $1 million. Regulation will cost a few $1 million. They can potentially earn tens of millions of dollars, maybe $50 million, maybe $80 million from users in Vermont, depending on tax rates, substitution effects, or price elasticities, not substitution, sorry. And then there's potentially hundreds of millions of dollars available from out of state. But there's also a huge risk to going after that pool of revenue. There are also other potential costs that matter a whole lot. Increased use might increase the need for treatment, probably will. There's also a greater need for prevention messaging, especially to adolescents and youth. There might be more impaired driving. There might be cost to employers of trying to figure out compliance both with state and federal laws and figuring all of that out. And all of these have a lot of uncertainty and not a whole lot of research behind them to inform us yet. So we need to think through those things very carefully if we were thinking about doing a true cost-benefit analysis of legalization. The biggest wild card, and John spoke about this before, more eloquently than I possibly can, the big thing we don't know yet is the relationship between marijuana consumption and consumption of other drugs. There's no consensus yet, despite lots of research on the relationship between marijuana and alcohol. There's some consensus, or pretty good consensus, that marijuana use is positively related to cigarette use, to tobacco use. And as John mentioned, it's a neat thing to think about is the idea of combustion versus vaporization is potentially a useful public health good externality of marijuana growth, though it's probably true that tobacco use will grow along with cannabis use. And then there have been actually recently a number of studies showing a negative relationship between prescription opioid use in marijuana, medical marijuana states and medical marijuana uptake. But there's not a whole lot of information. We need more information on that as well, but it's potentially a substitute. And then there are lots of other illegal drugs. There's synthetic drugs and all sorts of interesting things that we have very little information about and haven't had we're just learning about new drugs, and to think of how those might be affected by marijuana legalization is important, but we haven't done it yet. So last thoughts. Vermont should be commended for seeking rigorous study ahead of time. It's rare, it's special, so congratulations to them. There's tons of uncertainty in a lot of the parameters that really matter a lot for legalization, and there are a lot of options. And the amount of uncertainty and the effects will depend a lot on the particulars of each option and what it gets. So when someone asks you for regulation, it really depends. In what option is best?
And I want to, I don't have a lot of time here, and I can have a lot of charts and graphs and interesting things I can tell you about if you want to come chat with me afterwards or email me at the address that you see in the bottom of the screen there. But I want to hit you with kind of three big ideas that three big things that we've learned from Washington's experience. First, prices, of course, have fallen substantially over time since legalization, and that's as a result of several factors. I'm going to break that down for you. Secondly, the product characteristics have changed dramatically. And so growers and processors are working as hard as they can to respond to the demand that they're observing in the market, and we can illustrate that for you with a couple of nice charts. And finally, the tax change, even though it was a rather massive change that really decreased prices in one fell swoop in the market, did not have a large effect on quantity, suggesting that demand for marijuana, at least aggregate demand for marijuana in Washington state, is inelastic, which has some interesting implications for thinking about the interactions between the legal market in Washington and the illicit market in Washington. So what allows me to say all these things? We've already had a couple of people mention the traceability system and that data. We are the researchers who are using that data to give you information today, and so I want to talk just a little bit about that. Washington uses a seed-to-sale tracking system designed by BioTrack THC, and each firm, each individual participant in the legal market must report all movements of cannabis plants and products through the entire supply chain to the state through an electronic tagging and tracking system. If they want to move locations, if they want to sell it from a grower to a processor, they have to report to the state what car they're using, who's going to be driving that car, what their route is, every step along the way. They have to weigh their plants before and afterwards. It's designed to prevent diversion, and it allows us to have some information about what's going on in the agricultural process. Retail products are tested. Those test reports are made available to the state and to consumers, and we use those to get an idea of the product characteristics and how these firms are responding to demand incentives. And so we went to the Washington State Liquor and Control Board and got an extract of their database that covers every single plant and every single product grown and sold in the state of Washington from July 2014 until December 31st, 2015. And we're working on updating that data. So we're not as of Tuesday or Friday, but we're getting close. And so we have all this information, including the prices that people pay at every step along the way, these transfers, and so on. Some information is removed. We don't know who the people are that are driving the trucks, which I do some work on labor, and it would be kind of nice to know who the people are that are driving the trucks, so we could have some information about learning by doing and so on. But that's kind of getting into the weeds for economists. The summary is that we have 12 million dispensary transactions between July 2014 and December 2015 to analyze and figure out what's going on in this market. So the big thing is that entry has been very high. You'll see 2 points here, two dash lines on most of these charts that indicate 4/20, which was a rather notable day in Washington's market, and when the tax change was implemented. So the horizontal axis on most of these graphs is going to be time. And you can see here that entry in this market has been high and continues to remain high. It's starting to level out just a little bit. This is the number of dispensaries that are selling legal cannabis in each individual week, and we've now reached almost 200 individual dispensary locations in the state of Washington. The supply, as a consequence, has increased substantially. There was a lot of anecdotal evidence, a lot of newspaper stories when marijuana was first legalized in Washington, that supply was hard to come by, that there were a lot of problems with growers. We've been able to document that, and individual retailers had very small stocks available right at the start. Now, the mean retailer has about 15 kilograms of marijuana product available on a daily basis in Washington. So the supply is sort of worked its way through the system. Retail prices, as a consequence, have declined very dramatically over time. So the solid line here is the retail price. This is the average price weighted by sales at the dispensary level throughout the entire state. The dashed line here, which corresponds to the right-hand axis on the chart, is the wholesale price. And so we've seen a large decrease in the wholesale price, as well as a large decrease in the retail price as well, from about $25 per gram to about $9.75 per gram. Again, that's sales weighted, and there is a big distribution of prices for different products. I should mention at this point that these charts are for products categorized as usable marijuana only. So we're not thinking about edibles at this point. We're not thinking about some of the other products that have been made available, at least for this presentation. You can also see this. We did a kind of a simple reduced form regression analysis.